Good afternoon, ladies and gentlemen. Thank you very much for this invitation. I'm Agung Waluyo. I'm from Faculty of Nursing, Universitas Indonesia, and I would like to share my experience in the ATHENA as one of the evidence-based practice implementing in the prison. Let me share the slides. Okay, so again, thank you very much for this invitation in the International Conference on the Cutting Edge of Evidence-Based Knowledge Translation in Nursing Disciplines at College of Nursing, National Yang Ming Chiao Tung University in Taiwan, April 20th, 2023. I would like to thank to Professor Shu Ju, who inviting me to this opportunity, and I'm very glad to share my experience, and thank you for this invitation. And let me starting with telling the current practice of HIV care in the prison and the clinic, especially in the prisons. There are health professionals, doctors and nurses in the clinic and the public health centers who are helping distributing and monitoring ARV adherence by pill counting. In some prisons, the HIV care is not available, especially if the number of patients or the program of HIV care in the prison is not yet there. So this create the ART coverage in Indonesia for all people living with HIV only for about 17%. And it can be lower in the prison. So based on the research of me and the research team, found that ATHENA is one of the method where the individual level intervention in which HIV positive patient receive to 24 adherence related home visits from nurse and community worker pairs. So the HIV positive patients are encouraged to identify individual and social factors they perceive influence their success with antiretroviral adherence. And they take action to address problem issues and reflect upon the effect of their action. So the whole program is they are accompanied by nurses and peer educators during in their prison sentence and also after they release from the prison. So ATHENA is HIV positive patient define the content and outcome of their own learning through structures and tailors discussion with the nurses and the community workers or peer educators who serve as an expert resources and source of support rather than a voice of authority. So in addition to home visits, HIV positive patients receive usual care, which include adherence support, review of patient medication, and development of individual medication schedule. So as we are aware that HIV life cycle is really related to the how to how ARV therapy works in the people living with HIV. So the ARV can interfere the binding and fusion between the virus and the CD4, how they can enter the CD4 cells, reserve transcriptions, integration, viral RNA and protein expression, assembly, budding, and also maturation. So the ARV therapy try to stop this process, and then they can stop the replication of HIV virus. So in the normal situation, when the virus is infected patient, the number of CD4 is decreasing significantly, and the viral load is increasing significantly. So this situation create where the viral replication might be stopped or interfered by the ARV, so they may not be spread out to the blood vessels and lymph nodes, and this condition can create decreasing the plasma viral load and symptoms of acute infection resolve. So this ATHENA is trying to improve the quality of life of people living with HIV. So we are trying to implementing this method in the prison, especially for people living with HIV in the prisons. So we are at least facing 3 challenges. First is physical challenges as a stage of age is coming, like fatigue, physical limitation, inability to take stairs, and others. The patient might have also underweight, darkened skin, and loss of appetite. They might also have or experiencing lack of sleep and pain. In mental challenges, a patient might have anxiety, depression, and frustration. So these might also mental factors that focus help by the nurses and the peace educators. In social challenges, they might have social isolation, like in the prison, the patient try hard to cover their HIV status in order to prevent stigma and discrimination among prisoners. They also have lack of recreation. For sure, if they release and if they trying to find a job, then if they discovered HIV status, they might facing jobless and they have no income. So how can ATHENA can help nurses improving people living with HIV well-being? So ATHENA and nurses assisting the people living with HIV in the prison to adherence to the ART. As this data showing that Indonesia where have more than 200,000 people living with HIV, only less than percentage coverage by ART. So we trying to increase this number, the percentage of coverage of ARV by the people living with HIV, especially where they are in the prison. From this slide also trying to show you where, although Indonesia have less than a million patients identified as people living with HIV, but the speed of increasing number of HIV patients is very fast. So how to assist people living with HIV for their well-being. We try to introduce ATHENA, where ATHENA is adherence through home education and nursing assessments. So home education is reflecting where the prisoners have been released from the prison. We still give the ATHENA method or assistance during they are in the community by giving them home visits. So the ATHENA goals is increasing knowledge, skills, motivation for taking ARV therapy. So the nurses and the peer educators are the main resource and make the patient as the experts for their needs. So the ATHENA in our program try to help people living with HIV in the prison because they have been marginalized, not only because of double stigma they receive, but also integration of health services toward people living with HIV, prisoners, among ministries like Ministry of Health and Ministry of Law and Human Rights and the local government have not been implemented. So the existing health services is provided in the hospital, and if the patient, people living with HIV, is received sentence in the prison, some of them are out of the service. So by giving the ATHENA, they might have the opportunity to connect with the dots in maintaining health status of those people living with HIV in the prison. The ATHENA itself allows people living with HIV and their family improve their knowledge, skills, motivation for taking ARV, assisted by nurses and peer educators to empower people living with HIV, implementing self-care based on their needs during they are in the prison and after they release. ATHENA has been implementing in the prison clinics and the community from 2018 to current. So the project is supported by Ministry of Law and Human Rights, Puskesmas we call, or Public Health Center under Ministry of Health, and local government. So before we launch the nurses and the peer educator to be a counselor who delivered ATHENA method, they are trained by the trainers who are certified to give counseling. So all of us are trained, and after we examine as an excellent counselor, then we receive the certificate and start to deliver the ATHENA method. So when the ATHENA intervention method is implementing in the prison A in Jakarta City, we try to empower the people living with HIV in the prison that they know their health status, they are aware that they need to keep maintaining their health status on optimum level, and they can do adherence to ARV therapy. And this is the picture of the ATHENA intervention implemented in Prison B in Jakarta City and also in the community. The challenge we receive are implementing the ATHENA in the community because some of the patients are trying to hide their HIV status to their family. So we might see the patient not in their home. So we try to ask the patient to choose who are their support, like their friends, close friends, or their peers, educators. So, but other patients who are not trying to hide their HIV status, they are receiving their support from their family. After we implementing the ATHENA through 2 prisons and in the community, and when it went well, then we try to disseminate the result of the ATHENA through the workshop with Director General of Correction of Ministry of Law and Human Rights. We are not only making policy brief, but also implementing the result of the evidence base in the prison, in 2 prisons in Jakarta. The Ministry of Law and Human Rights, especially in Director General of Correction, promised us to spread the implementation of the ATHENA not only in these 2 prisons, but also in other prisons out of Jakarta city. In this workshop, also attended by the representative of Ministry of Health and Public Health Centers decision makers. So what did we share the content of ATHENA to people living with HIV is the content where we try to improve people living with HIV well-being through their belief. They try to believe that they have the previous belief where people living with HIV, if they don't take ARV, they are just okay. But in fact, some of the evidence people living with HIV in the prison who are in AIDS situation, they are in a very severe condition. So we try to give that example to show and try to show the figures in these pictures where people living with HIV may feel healthy for many years, although the virus is living in their body. But as soon as the number of virus is increasing, then the situation is changing. The patient is getting worse, the number of HIV virus is increasing, and the number of CD4 is decreasing. So this can be prevented by taking ARV adherently by the patient. So we try to introduce that if they can take ARV therapy adherence, the HIV will die in the body, especially in the blood streams. So the HIV treatment is the highly effective at stopping HIV. So the ARV can reduce the virus in the body, and the level of quality of life of the patient can be improving. So this is the picture we show to the people living with HIV in the prison, where if they take the ARV therapy, the CD4 cells can be higher and the viral load can be lower. The picture of the blood drop of the left side is before the ARV is taking, and the middle side is after ARV taking 6 months, and the right side is more than 6 months ARV therapy is taken. So the patient can spend less time in the hospital or in the clinic, and they can more time doing what they enjoy, especially after they release from the prison. And the other thing that we try to make them realize that when they adherence to ARV therapy, they can stop the infection of their partners, and they can also prevent their partner of being infected again. So we try to make them realize that no infection have been documented when a patient has been taking ARV for more than 6 months, and the viral load is very, very low situation. So starting ARV greatly reduce the risk that you will or the patient will infect their partners with HIV. So the viral load should be lower in order to prevent the spread of HIV to their partners. But we also realize that saying the HIV status is not an easy thing. So we open a discussion. How can they talk about their HIV to their partners? Not only to their partners, they also try to discuss how can they talk their HIV status to their family. So one situation that we try to share with them, by inviting the HIV positive patient who are an ex-IDU and also who are an ex-prisoners attend to that discussion session. So they can share what is the best practice to share the information about HIV status to their family and to their partners. And if we see the main player of this education is peer educators who are HIV positive patient and ex-IDU drug users and ex-prisoners, what are the role of the nurses? The role of the nurses, if answering the question related to the ARV medication and ARV side effect. This is one of the questions that have been raised by the people living with HIV in the prison. What if I skip a dose? Am I going to die soon? What will my family say? Should I give up the therapy and so on? So this question have been raised by the participant who join with the ATHENA when they are in the prison and when they are in the community. So this is also the other question that have been raised by the patient. Will my friends avoid me if I'm taking ARV? Will doctors help me if I have problems with medication? Could ARV kill me? Does ARV even works? And so on and so forth. So we try to endorse the thought of they might want to see their children grown up and also perhaps seeing them getting married. So we want them realize that they have a good future life. So they have to keep their health status in the optimum level by taking the ARV. So they also want to stay active and feel healthy, and they want to keep their partner safe from getting HIV infection. Since Indonesia is one of the most religious country in the world, we try also to endorse the religious or spiritual point of view by saying one of the point in Quran or in the Bible saying that God does not send down a disease without also sending its cures. So therefore, people living with HIV should seek and search for its treatment. So they might perhaps think that they are not responsible for their infection, but they are responsible for their treatment and for their partners. So that is the main issue that we are trying to make the people living with HIV realize. So as the conclusion, the incarcerated people living with HIV experience increase of knowledge, skills, motivation for taking of ARV therapy. The CD4 increased significantly and the viral load is decreased significantly. Nurses and peer educators are good combination of resource, not only in the prison, but also in the community. And the incarcerated people living with HIV become more experts and expert for themselves. So that's all for the presentation. Thank you very much for this opportunity. And this is a reference that I use for sharing this experience. And thank you very much for the time and good afternoon. Bye-bye. Thank you again for Professor Shishu from Taiwan University.